Well, we've all heard of COVID-19 super spreaders, but this next story is a grim reminder of just how far and quickly the virus can spread. Nearly the entire town of Kliprand near Cape Town has been placed under quarantine. The Gift of the Givers Foundation says virtually every one of Kliprand's 65 homes has reported a coronavirus infection. Well, with little economic activity, the rural community is being pushed further into poverty, and so has been the case throughout the pandemic. Gift of the Givers has boots on the ground. For the latest on the situation, the AIDS organization founder, Dr. Imtiaz Sooliman, joins us live. Dr. Sooliman, it's such a pleasure to talk to you, and I am still upset that you did not receive a Nobel Peace Prize.
Thank you very much, Anika. It doesn't really matter. You've got the support of all South Africans. That's more important than the Nobel Prize.
You're absolutely unbelievable. And here's another case again where you are moving in to help the people in a town who are utterly under quarantine. They're isolated. There is no Uber Eats. There is no Checkers Quick or, you know, whatever to get them food. How are they surviving?
That is first of all from your introduction. We don't even know how the virus got there. You know, it's so far away from Cape Town. You would think, did you find a GPS system to get to? You know, the Klip-rand, there's nothing there. There's gravel roads on the way to Kliprand is the closest town. Gravel road all the way to Klip-rand. There's no shops, no banks, no supermarkets, no real, shopping center. It's just dry area. And you can't understand how the virus got there. But fortunately, and to the credit of those who went to vaccinate the people, they picked up through the screening that more than 30 people were infected. So all credit goes to the screening, to the vaccine team that found that the people were infected. And of course, it was a good decision to close the town off. The problem is they have no access to food. You have to book a taxi. There's no Uber Eats. You have to book a taxi. You have to go to a nearest town over 100 kilometers away. They don't have any surplus food or water in the area itself. So basically, they totally depended on outside assistance. And when we heard of the plight on Saturday, we quickly mobilized, and just that our trucks were busy in other parts of the country. And today our team is virtually half an hour outside the town right now, waiting to move in with food parcels, bottled water, hygiene packs, special COVID-19 packs, and even COVID-19 medication packs and blankets for the people. Also bulk food for the feeding centers and nutritionally enriched peanut butter for the school children.
I suppose they must also need animal feed, doctor, and medication.
Medication we've arranged. It's gone with the teams into the area itself. There is a COVID-19 home pack. You know what? We arrange vitamin C, zinc, selenium, quercetin. There's sometimes alcophyllex for cough, Panado. They are a basic type of items that you use in these conditions, which all the healthcare professionals, it varies. Everybody's got his own preference, but there's virtually a 75% to 80% standard pack, which most people use with home care. So we've sent those items also with the team to go into the area. You know, yes, fodder we have been doing in different parts of the Northern Cape and Eastern Cape. We're now busy with supporting a farmer and his wife. They make pallets. These are nutritionally enriched food for animals, which means you don't have to carry so much of fodder on trucks, and the transport cost is very, very expensive. So it's fortified pellets. It's much cheaper. You can have it in feedlots where the sheep don't have to go out into the field, where they become victims of scavengers, or predators. They're basically in a feedlot, and they can eat near near the house or where the farmers are situated closer for protection, or where, in that matter, even the cows. So it's something we may have to look at in Klip-rand. They haven't asked for it yet, but it's a possibility that something that may come up next. But right now, it's about survival, about staying alive from the COVID. Unfortunately, 3 people have passed on, one of them being a learner at the school, and the rest of the population, a lot of them are affected. So we hope that this phase will pass, that there'll be no more deaths, and that's the first thing. Survive the COVID, they'll have the food and the water, and of course, thereafter, it's again bleak, because most of them are farm workers. The farmers are not functioning, they don't have any jobs, and they're dependent on outside for support.
Doctor, I'm going to divert you now to Gauteng. There's been overwhelming need for oxygen from Gauteng. Just how dire is the situation there, and how are you dealing with it?
It's absolutely dire. When physicians and doctors start calling you and say, you know what, we're desperately in need of oxygen concentrators. And ask them, why oxygen concentrators? We didn't use so many, in the first wave and the second wave. Yes, we did use. There were groups that bought. They said there's no hospital beds, so we can't send patients to hospitals. What are we going to do? Are we just going to let them die? Let's give them a chance. And there's general practitioners and physicians actually treating people at home and going to their homes. And then I asked, but so many people had oxygen concentrators. And one doctor would tell me, we had 140 and they're all gone. Another 500 won't be enough. And another area, another guy says, we had over 100. If you give us another 100 or 200, they won't be enough. The rate of infection, the rate of oxygen requirement is going through the roof. And patients can't go to casualties of hospitals because they wait for hours to get in. And when they're inside, there's no guarantee of a bed. Or the lucky ones get a bed, 1 or 2 or 3 get a bed. The rest are sent back home. And it's anxiety just aggravates the situation. So there's a huge need of oxygen, and oxygen concentrators it's like a band-aid right now. When you need higher than 5 liters and 10 liters, what do? You don't have the facility, you don't have the beds to take the patients to the hospital, and and people are going to die. And that brings you to the next point. We need more hospital beds. And the most obvious hospital bed right now is Charlotte Makeke. It makes no sense to keep a hospital like that closed that looked after 300 COVID-19 patients at the peak of the infection in the second wave. 300 beds wasted. Yes, I understand. The part of the hospital is burned, but the whole hospital didn't burn. So we need some active leadership. We need somebody in government to take a decision to say, look, this is an emergency situation. We need to save lives. What's more important? The certificates or the papers or the rules of the hospital to make sure it's functional, or saving lives? You need to equate which is more important. And that's why you have disaster regulations. I've been to the hospital myself 2 weeks ago. Yes, there's a burn part. It's structurally unsafe. But engineers know how to separate a damaged part from the rest of the hospital. They do this all the time. And if they can do it, at least 2/3 or half of the hospital can be functional, we can create more beds and many more lives can be saved.
Dr. Imtiaz Sooliman from Gift of the Givers, thank you once again for rescuing those South Africans, our people who are in desperate need. Once again, you're just shining lights in this country. Thank you.